Hi, my name is Paige. This is our ear, nose, and throat exam, and we'll start by having our patient read our release statement.
I, Hayden Bowen, voluntarily give Maryville University permission to record my image and or voice and grant Maryville University all rights to use this recording in any medium for educational or other purpose that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. I give my express consent for this information gathering and physical assessment to be filmed and posted in the student's course shell for access by faculty and students at Maryville University. I further acknowledge that since the recording is for educational purposes only and the information is not meant to be diagnostic, therefore Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student in any of their devices as soon as it has been reviewed and graded by the instructor.
Perfect, thanks. Now we can do the room scan. Perfect, so now we can start our examination. So we'll first start by looking at the patient's skull, and we're going to inspect the size and shape and notice any masses or any areas of tenderness. And then we'll come around to the face and look for the similar things here. We'll look for discoloration, any edema or swelling. We can also look at the eyelashes and the eyebrows, noticing the shape and symmetry. We'll look at the lacrimal apparatus by noticing any edema or drainage. And then go ahead and open your eyes. We'll look here at the sclera as well as the conjunctiva by pulling down and have the patient look up in the air. Here we're noticing color and vascularity, which look normal. We can then look at the pupillary response by first looking at the pupil's reaction to light, checking this one first. And then look at the pen light as it goes towards your nose. Perfect. The pupils are equal, reactive, and accommodating. So then we can look at the peripheral vision. So we'll have the patient cover his left eye, and I'll cover my right eye. And then he will tell me as soon as he sees my fingers come into his visual field.
Yeah. Same. Mm-hmm.
Perfect. And same on the other side.
Yep.
Perfect. And then we are going to check cranial nerves 3, 4, and 6 by checking the oculomotor muscles. So I'll have him follow the pen light in the 6 visual fields. Perfect. That looked awesome. Following that, we can further check the visual acuity with the Snellen chart. So I will stand 6 feet away from him and have you cover one eye at a time. And then read the smallest row that you can.
LTFPH.
And cover the opposite eye and do the same thing.
LTFPH.
Perfect. So he has 20/20 vision. The last part of the eye exam is with our ophthalmoscope. So we'll start with the ophthalmoscope about 10 inches away, and I'll use my left eye to look at his left eye and my left hand. And here we're looking at the retina as well as for the optic disc, the blood vessels, the macula, and the fovea. And the same thing on this side. All of those are visualized and look normal. Following that, we can move on to our nose exam. We're going to palpate the nares, or first we're going to inspect for symmetry, deviation in the septum, and then we can palpate the nares for any foreign objects or tenderness. And then we can use our otoscope to look inside the nose. Tilt your head back a little bit. We'll look inside each nair. And here we're looking for any bleeding or exudate or any deformities or polyps. Looks normal. And same thing on the other side. Perfect. Also part of the nasal exam is palpating the frontal and maxillary sinuses, which are up here. We're monitoring these for tenderness on both sides. And then we can move on to our ear exam. So the first thing we want to do is look at the external ear and the auricle on both sides, noting symmetry, looking for any lesions or masses or any abnormalities at all. And then we can look at the external ear as well, looking for the ear canal, looking for any drainage, foreign objects, redness or swelling. And then we can have the patient tilt his head down towards the shoulder, and then we'll look at the inner ear with our otoscope and look so we can visualize the tympanic membrane. And same thing on this side. The tympanic membrane is a pearly gray. There's no redness noted. After we look at the ears, we can go on to our hearing assessment. We'll use a tuning fork to check lateralization. So we'll place the tuning fork at the top of the head and then check to see if one ear is stronger hearing than the other, or if they're equal. Did you hear them equally on both sides?
Yep.
Perfect. So then we'll check the left ear and then go on to the other one. This will check for bone conduction as well as air conduction. So tell me when you stop hearing it. I'll put it against your mastoid, and then tell me when you stop hearing it, and then when you do, I'll move it to the outside and tell me when you stop hearing it.
No. No.
Perfect. And same thing on this side. The bone conduction should, or the air conduction should be twice as long as the bone conduction.
No. No.
Perfect. And his were about twice as long on the air conduction. And then the final part of this is the whisper test. So I'll stand about a foot behind him on each side and say a word that is about 2 syllables. And then he can cover the left ear, and I'll whisper into the right ear, and then repeat the word back to me.
Mushrooms. Flowers.
Perfect. So that concludes the ear portion. So now we'll go on and visualize the mouth. First, we inspect the lips and notice any cracking, discoloration, or edema, or any abnormalities on the lips, and then we'll have him open his mouth. We'll look at the oral mucosa for any white lesions, any discoloration. We can also look at the teeth here, note any missing teeth or bleeding. We can also look at his tongue, note the color and the texture of his tongue, and then lift your tongue up against the roof of your mouth so I can see the under part. Same thing here, we're looking at the color, and then go ahead and say ah. For this portion, we're looking at the tonsils, as well as the uvula and the hard palate and the soft palate. The uvula and the soft palate move with sound, so that's checking cranial nerve 10. Perfect. And then the final part of this assessment is the lymph nodes of the neck, and here we're looking for any swelling or enlargement or tenderness. So we're going to start with the occipital lymph nodes, then move to the pre-auricular and post-auricular, the tonsillar lymph nodes, submandibular, submental. We're going to look at the superficial cervical lymph nodes as well as the deep cervical lymph nodes, and clavicular lymph nodes. We'll also look at the trachea to note any deviation, and then we'll assess the thyroid, both swallowing and not swallowing, and note for any symmetry or any size deformities there. And that concludes our assessment.